Good morning. Welcome. You are watching Visionary Aging. I am Mary Winters, a gerontologist, the owner of About Senior Solutions, and I am here to show you what power you have to own your future and the way you want to age. So this is a program about resources and questions to be answered, and we are here to make sure that you age successfully however you want to do that, and that changes all the time. So we need to readdress what you may need and make sure that you are safe and sound and getting exactly what you want. So we're going to go ahead and start off with a caregiver question. Let me go ahead and see if we can find, let's see, here we go. Good morning, Steve. How are you? Oh, we're muted. I'm probably muted too. Oh, no, I'm not muted, but you are muted. Okay, now you're not muted.
Is that better?
That's better. So tell me, what kind of caregiver question do you have today?
Our caregiver question today comes from a gentleman. His parents are elderly. They've been kind of on lockdown with COVID. And now that things are opening up, they're not really comfortable going out. So he wants to know what he could do to get his parents out or convince them that it's safe to go out.
You know, it's really hard. And I think people became very accustomed to isolating themselves. And I've even mentioned this over time. I feel like kind of a mama bird pushing people out of the nest a little bit. And so I think people do need to feel safe. They have become more sedentary, and they're losing more muscle mass and sitting on their chairs and basically not connecting. I see some really big declines because of it too, especially cognitively, and things are not being addressed health-wise either. So going back to their concern to getting them out, try some little things first. See how far you can get them out the front door, so to speak. If you can get them on the front porch, will they go in the backyard? Can we try a drive in the car where we're not getting out? And then from there, maybe we can try a little meal of maybe their favorite restaurant, something that you can kind of use as almost like a little bribe, or maybe that's actually coming to your home or to another friend's home, so that we can gather and eventually get people to feel comfortable seeing each other and hugging again too. I think that's also super important. So yeah, I'm really concerned about the kind of slide back we've had emotionally, and I'm seeing people become much more aggressive too when they're out in the community. So just be cautious, and I think we have to be almost a little defensive, like a defensive lineman, but when we're driving, we have to be, I think, a little more defensive and be aware. People just aren't used to driving. I think we need to be more aware of people snapping quickly too, and being much less patient. So I think we're all learning patience again and how to communicate and interact with people, which is also kind of interesting.
Yeah, I think the tolerance level of people has definitely declined. The last couple of years.
Sure. I think when you're just by yourself all the time and you have nobody or very few people you're interacting with, and all those skills, we've lost those skills and we need to regain them.
I agree.
Yeah. So we have a really great guest. I'm
excited. Yes.
Yes. So we have Dr. Sagon. I know I'm going to mess her name up.
Aclisto?
Aclisto, thank you very much. And she is an audiologist, a doctor of audiology, and she's really amazing. She's done some really great research. She's been published. She had a residency that she did over at the Tripler Army Medical Center in Hawaii. She also worked with she worked with the Here Institute. I'm sorry, I'm going to mess everything up today.
Let's get to the interview.
Work with some very phenomenal organizations, including UCLA Hearing the hearing center of UCLA, and she's now one of the senior audiologists over at the Doctors of Hearing. She's a fabulous mentor to other audiologists and people coming up into that field, and she loves donating her time and spending time with her family. So let me go ahead and introduce her, and
Have a
I
great
will
show.
see you later. Thank you.
All right.
Good morning. How are you?
Morning.
I'm having lots of challenges getting my words out today. So maybe there's actually something wrong with my hearing. What do you see about things like that where people are not necessarily comprehending? You can see that they're not comprehending the words.
Yeah, it's like you mentioned, I'm a cochlear implant specialist at Doctors of Hearing, and as we age, just like a lot of other things, our hearing sensitivity is diminished, and that can be progressive over time. Everyone knows about hearing aids. That's a solution for hearing loss, definitely available to majority of the population. But not a lot of people know about cochlear implants, which is a solution that can be offered to those who don't do well and meet other criteria, and they're not doing well with hearing aids. So there's this whole frustration, and I hear it from so many families. I've tried hearing aids, it doesn't work well, it ends up in the drawer. Well, number one, let your audiologist know, because there are so many programming changes that we can make to try and help you. And also we can help you through trying to get used to wearing the hearing aids. That's the primary thing, is wear them so you can retrain your brain to listen again, right?
Oh, that's interesting too, retraining your brain. I have found it very interesting. I have a client who was already using your office, and we had a problem with her hearing. She just wasn't able to acclimate well with the hearing aids. We knew that she was having some memory loss on top of that. But it was so great to see everyone there dig in and problem solve, and some of the adjustments that we made. And I was absolutely flabbergasted when one of your doctors said, I think there's just a little bit of wax and it's actually affecting her hearing aid, and she has a very small ear canal, and so take her to the doctor, see if her primary will clean her ear. And so primary doctor said there's not enough there to really worry about, not a big deal. And went back to your office and they said, no, I think it really will matter. Let's go to the ENT. And I'm thinking, oh my gosh, we're going around in all these directions. We go to the ENT and she said, oh yeah, she has a little bit of wax. She pulled out, I'm sorry, excuse me, but it was about a size of a corn kernel out of her ear. And they said that was just a little bit of wax. All of a sudden her hearing aids started fitting. They weren't buzzing in her ear any longer. Oh my gosh, what a simple thing. So we've now put a protocol in our office as to how to support clean ears and better hearing with their hearing aids. And so we've since been using your office for more of our clients because we were just so impressed with your problem solving.
Thank you. Yeah, we've seen you around the office a lot, so that's good. But you're right. Even if it's a tiny piece of wax, it could be just in the right spot. So when you put the hearing aid in, it's right up against it, and that sound is not going to make it past, So it doesn't have to be completely occluded to start affecting what you're getting naturally and also through the hearing aid.
That's it. So some people have more propensity for wax in their ear. And what would you recommend just to kind of maintain a clean ear without having to go to the ENT all the time?
Yeah, so usually we actually say just leave it alone, because wax will naturally work its way out. And some people will also see, as they remove their hearing aid from their ears, some of that wax gets stuck in there. So they're actually removing it themselves. I don't usually recommend putting anything in your ears or trying to pull it out yourself, because you can't see where you're going when you're sticking things in your ears. Right. So if we ever look in your ear and we think, it's kind of building up, I always recommend for the patient to see an ear, nose, and throat doctor, because they can see exactly what they're doing, and they're the ones that can recommend a more appropriate maybe pre-treatment before they try and scoop out that wax.
Oh, that's great. So talk a little bit more about the cochlear implants. That's fascinating to me, and fantastic that you're a specialist in that area too. Um, when do you come to a conclusion that a cochlear implant is really the best thing for the individual?
When it comes down to it, it's patients who meet several criteria actually. And one of them is that you have to have a hearing loss that falls within moderate to severe range. And when we say moderate to severe, I know you've heard me explain an audiogram before where depending on where your thresholds or the softest sounds that you can hear fall on the graph, it can be normal, mild, moderate, severe, and profound. So obviously normal is the best, and as you go lower on the graph, it gets worse. So if you ever describe a hearing loss as moderate to severe, and your word recognition score is low, and you're not doing well with hearing aids, then you could possibly qualify for a cochlear implant. But the first thing that you would have to do is, one, get hearing aids to see how well they help you. And if you don't do well, then number two would see a cochlear implant team so that they can do a full evaluation. Because just because your hearing test looks like you qualify, the evaluation might show something different.
That's true. And I know too that you have a background with pediatric audiology, and so I mean, there's normal hearing loss, and there are losses that are not normal, obviously. So, I mean, you've seen some children with some very severe loss. Share a little bit as we age, though. What is normal? What is not normal for somebody who had not been hearing impaired as a younger person?
Well, it's hard to say because there's no. A lot of people ask, I'm 75. Does this look normal for my age? There's no actual normal, but we do know that hearing loss can start even as young as maybe even 50. Everyone's background is different, so everyone has a different level of noise exposure, maybe even exposure to some ototoxic medications, your history, your family history. But usually with hearing loss that occurs with aging, it starts at the higher pitches. So the higher pitches would be more responsible for the details of speech. So a lot of times people come in and they say, I don't have a hearing loss, I can hear. It's just hard to understand sometimes. And that's what it is those higher pitches are responsible for the details of speech, the difference between S and F, or those high pitched sounds that naturally you can't even, as a speaker, make those sounds louder if someone can't hear them, right? They just they come out of your mouth softer. So, usually what I see, if it's kind of just aging that's causing a hearing loss, is a high frequency hearing loss.
Okay, interesting. And what are some of the remedies other than hearing aids? Are there other remedies to improve your hearing if you are having a loss?
Not to improve your hearing, but to protect the hearing that you have. I mean, it's good to keep an eye on your environment. Wear hearing protection if you do anything that's hazardous to your hearing. That could include concerts. It could include recreational activities like riding a motorcycle frequently, firearms. Even if you go to a fireworks show or you're around cars that are very loud, stuff like that. It's good to keep an eye on your environment.
It is. In fact, I've been around a rock band more recently, and I bring out my decibel reader and let them know they're too loud.
Yes, I know people look at me funny when I say wear earplugs when you're at a concert, but honestly, even if you put earplugs on, you can hear exactly everything that's happening because it's so loud.
Yeah. Oh, yeah, for sure. And I think they were even saying that the Rolling Stones play at about 93 to 103 decibels, and that's loud. That's very loud.
It is, and you don't know unless you actually measure it like you did.
Right, right. This is my little meter. You
Yeah.
have to see that you're over. Uh, well, let me share something else in regards to the types of hearing aids because there's so many different unique things that are
Mhm.
really new in comparison to what we had 10 years ago, 5 years ago. So maybe share some of those unique new products that are out too.
Yeah, it, hearing aids sometimes have a bad reputation because we remember what our grandparents wore and how our grandparents didn't want to get hearing aids until they're much older and they just realize I can't understand anything. Um, so that's kind of what the thought is, but there are hearing aids that are a lot more cosmetically appealing now. There are hearing aids that work so much better because they're digital, programmable, they're smaller, and they also have pretty aggressive noise management systems in them. So that would be for people who are in multiple different environments. So restaurants, meetings, even the dining hall if you live at a senior home, where the hearing aids continuously read your environment, and if it detects background noise, it will suppress that back microphone. And with some of them, depending on what tier you get, those microphones will continuously roam and search for the speech signal. And when it finds it, it brings it up compared to whatever's going on in the background. And we still have those hearing aids that are very, very small, and then a little bit bigger, and then also the ones that go behind the ear.
Sure.
Yeah, so those are all still available, but it's what's inside the hearing aid that matters because the processing is so much better than even something that came out 4 years ago or 3 years ago. They're like cell phones, there's a new iPhone every, I don't know, 9 months or so. Same thing for hearing aids.
Interesting. Any of them have little beeper locators on them because it's still so common to lose them, right?
It is, yeah, especially with the mask use right now.
Yeah.
So there isn't, where I wish there was.
I think
But
somebody needs to invent that.
I know that needs to be the next thing, right? So with the hearing aids, there's one brand actually that if you've got a pair of hearing aids and one falls off, um, the partner that's still on your ear is going to give you an alert because it no longer is within that range that it can connect to its partner hearing aid. Yeah. And I had a patient tell me that was so helpful when he was outdoors because he removed his mask, didn't realize it fell out. And then this one kept making noise. He's like, why is it making noise? And he reached up and realized this one was gone.
Oh, interesting. That's
Yeah.
great.
Uh-huh.
Eventually, somebody will come up with Find My Hearing Aid, and it'll.
So there is an app on for most of the brands where you can pull it up on your phone and you can click Find My Hearing Aid and it'll detect the last time your hearing aid pinged to your phone. And it'll bring up a map, just like a regular map, and give you that address. So yeah, that's available.
Wow. Oh, I'm sure there are a lot of families and individuals who are really happy to hear that because that is not something that I've heard before. So
Oh
thank you.
yeah. Mm-hmm.
Well, thank you so much for the great information. I really appreciate your professionalism and your talent, your expertise. And if there's one last thing that you want to share with our viewers, what might that be?
We have, I work at the Doctors of Hearing Glendora location, but we have three of them. There's Pasadena, Rancho Cucamonga, and of course Glendora. And in the scope of audiology, we cover almost everything that's available. So hearing testing, vestibular testing, hearing aids, and cochlear implants. And if ever you're curious about getting a baseline hearing test, I highly encourage that. A lot of insurances cover it. So usually if there's something out of pocket, it would be minimal. And it won't be a surprise. We would check with your insurance before we do any type of testing, but it's always good to get a baseline just to see where you're hearing. Yeah, you never know. And also, if you have questions about, I have hearing aids and I'm not doing well, am I a cochlear implant candidate? Just ask. We're happy to look at an audiogram or do a hearing test and just say yes or no, or possibly, and then help you figure out where you need to go from there.
And that's so important because I think just having that security of knowing. Now, how would somebody get a hold of you? Should they call the doctors of hearing, or what's the best way to get a hold of you?
So the Glendora office number is 626-250-6642. And oftentimes we get calls that are forwarded from Pasadena. And if you reach the wrong office, just ask and we'll give you the proper number to call. But you can start with the Glendora location.
That's fantastic. Thank you so much.
Thank you.
I really appreciate this knowledge. And I'm learning new things just having you on the show this morning. So thank you.
Thank you. See you soon.
All right. Sounds great. Thank you. That was wonderful. I love that information. So important and helpful. And I've got to tell you, I'm really impressed. I've been taking some of our clients into the Pasadena office, and it's been a life changer for some of our clients. So it's been so valuable. I'm thrilled that we've been able to work with some of our clients that way. So let's talk about our birthday today. Here we go. Today's birthday is Ray Day, and he's over in Illinois. He is a World War II veteran, and they celebrated his 100th birthday over at the Milan Post 569. And their acting commander, John Flaherty, said, he's just an amazing man. It's not just that he's 100. He's still walking and working on his cars. He's just fantastic. He was married to his wife, Dolores, for 72 years, and he collects and restores Crossley cars. He works on a 1940 Bantam truck, and he's hoping the weather gets warm enough so he can get back out to the garage and work on that car. So happy birthday, Mr. Day. Thank you for your service and everything that you did to serve our country and everything that you've done in between all of that. You've had 100 years to do some fantastic things, and we appreciate that. Let's go on, and we'll see about talking with, we're going to talk with Melinda. So let's see if we can bring her on here. Let's find her intro. Good morning. How are you? I've got you muted.
Morning, and I don't know if you can hear, but there's like a car alarm that just started when you started the intro.
Oh, well, that's,
there it is.
That's just the way the day's going. All kinds of little faux pas there. So tell me, what are we going to learn today?
Well, we were speaking about spring cleaning the diet. So
Nice.
I was just going to give a couple of tips. Spring cleaning your diet doesn't need to be super difficult. You can just look for 1 to 3 things that you eat regularly or drink regularly that maybe have a high sugar content or are processed and aren't the best for your body. So if you're super motivated, you can choose 3 things. And if, when you want to start a little bit slower, or it's something that you eat or drink a lot, you can start smaller with just 1 thing. We had a client who had a weight loss goal, and the weight loss goal at a specific time for a trip. And she was a soda drinker. So we had her eliminate soda just until that trip. And she did meet her weight loss goal for the trip. So, changing that small thing over, say, a 6-month period can really make a difference to our health, whether it's weight loss or just our general health or, something going on. So just do a little clean sweep of your diet and see where high sugar content is or processed foods. And, choose just 1 thing and see if you can eliminate that.
great idea. Over the years, and I've kind of selected Lent. Not that every
Yeah.
Lent I've been able to do this, but kind of that time of refreshing and renewing and cleansing. And so over the years, I've eliminated dairy, I've eliminated caffeine, or at least coffee. And I know it's very personal. Not everybody wants to do that. I've eliminated sodas. So it's just kind of a nice little way to kind of put something in a little box for a short period of time and see if you feel better or not. Just commit to 30 days, say, for your little cleanse on one little thing. It really makes a huge difference, I think.
And sometimes you realize that you don't really desire that anymore. And
Sure.
it could become a permanent change, but it doesn't have to be. It can just
Yeah.
be, a short-term little sprint. So, yeah.
Yeah. So let's see. I think we lost. Oh no, Steve's here. And so we're going to bring Steve on. And yeah, so Steve,
Hello, Steve.
what day is it this day? Let's see. I think it's Earth Day.
Today is Earth Day.
It is Earth Day. What's tomorrow? Let's see what tomorrow is. We have the puzzle. The day after Earth Day. What is it? It's is it Picnic Day? Is that what it says?
Yeah, that's appropriate.
National Picnic Day. So take a great little basket out to the park. And to your question, Steve, how do we get people out? It's National Picnic Day. I think we get them out and they find a great little spot outside and enjoy their afternoon.
I think you're right, though.
Oops.
Oh, we lost him.
We lost him. We dumped him. We did that on purpose. No, he'll probably come back. But let me go ahead and we'll bring on our doctor of audiology and see if she has one last spring cleaning tip for us.
Did you say a spring cleaning tip?
Yeah.
Well, we always teach our patients how to clean their hearing aids, but sometimes if dexterity is an issue, we're happy to help. So just let us know.
That sounds great. I know. And how often should we be cleaning our hearing aids? Once a week or once a month? Or
Well, a deep cleaning, probably bring it in maybe every 6 months or so. But, there are things that you can do weekly to kind of help with that. And we teach them how to do that during their cleaning.
that sounds great. Well, everybody, have a fantastic weekend. And until next week, feel empowered.
Great show.
Thanks.